Okay, we're back. Now, really, just wanted to have a little bit of a committee discussion for the next 25 minutes or so. Um, to, just hear from people about reactions to the task force report from yesterday and some of their recommendations and the department's responses. Also interested in thinking about, what we've seen in terms of sort of like a draft outline of a bill and sort of the general area of trying to address homelessness and providing shelter to people when they need it. So really just opening up for people's comments and thoughts about where you'd like to see us go. Go ahead, Doug.
Shocking, I have something to say. I guess for me, ensuring we have a focus on service delivery to help people get out of homelessness. Otherwise, we're going to continue to have a discussion that is challenging for each legislative year, each legislative session. And I think if we can put in place something that moves the ball with respect to wraparound services or whatever that may be to help people move out of homelessness, that would be best in the long run for the people involved and for this legislative process.
Yeah. And when we're having committee discussion, unless it ends up being a free for all or something, and I have to kind of like, say, just feel free to just chime in. So you don't need to be called on.
Oh, right. I just want to attest to what said, because these are some of the notes that I put down. The current language as is really isn't. It's got some in there, but if we are being truly sincere of transitioning from a more of a benefit model to a program standard model, outlining service standards and responsibilities of participant are going to be key. And I also believe we also got to take a good look at the prioritization system.
Mm-hmm.
So two pieces: one, outline service standards and responsibilities of participants, and the second being a prioritization system to make sure that we are serving the most vulnerable in need, that will get the best benefit of this program.
Prioritization is an interesting thing because that's essentially the thing that the way the department went around it is a thing that I responded to that wasn't in keeping with legislative intent in terms of how they approached it. So I that's when I was alluding to maybe we need to be more specific in statute. That was one of the things that I was thinking. Yeah.
Well, this is for me really in sync with my ongoing and getting clearer in my mind distinctions. I think that this is simultaneously far too broad and far too narrow. I do not think there should be any days of restriction on days of eligibility. If a person is, working to seek housing and there isn't housing available. And I don't think we should have a priority listing that allows people only with certain characteristics, which then get into how you define a lot of those. But on the other hand, I think that those kind of no limits, no restrictions should be restricted to an actual definition of unsheltered homelessness. That's the part where I think it's way too wide with the definition of homelessness, not having appropriate housing versus unsheltered homelessness. But I don't think we should, particularly in terms of, what we're trying to do within understanding budget limitations, but I don't think that we should be not doing our best to provide shelter for any person who is on the street who has no actual shelter at all, without regard to whether they have particular. But I know, there's a lot of folks who, particularly if there were supports in finding stable housing, who actually who actually do have not adequate, not permanent long-term, but they actually have a current safe place. And I think this, goes too far, particularly in terms of access, because of course, then that access by those people reduces access. We don't have enough beds for people who are totally unsheltered and ending up having to sleep in a tent and so forth. So, so kind of the whole guts of the direction I have trouble with. And so I don't know if there's really leeway or path forward for my perspective on it, because it's so different from what the overall thinking has been.
Mhm.
But I think even the debate over contributing part of one's income, 25%, and I know I know throwing out 30%, right? Throwing out all these anecdotes, but this was somebody who actually did an interview last fall with one of the groups, and so she was under that requirement. And so as a result, because it's based on the month, basically you get X number of days that are covered, and then you have X number of whatever it is, 30% is, that are not covered. And so what she did is when her paid days ran out, she went and lived with her sister for a week, and then came back. And when you compare that to somebody who living in a tent or living in a bundle of people with men standing around to protect them,
Mhm.
I just don't think we've got the right balances here.
Mhm. Interesting, yeah. I think, to respond to your, is there a path forward for that kind of thinking? I actually think, from my perspective, I think there is, because for me, what has been striking in all of this is, I don't think all of those priority populations that even exist now are
Mhm.
all equal.
Right,
Yes, it's-
right, very
um,
much so, yeah.
And
A lot
that is the
depends
way
on
it's
that.
set up right
Yeah,
now.
yeah.
It is the way it's set up right now. And so and so thinking about that and thinking about that, I think we do need to create a program,
Mhm.
that has the supportive services that a more formal program would have. I think may necessitate us actually serving fewer people.
And if you, yeah, I'm sorry.
And fewer people in a way that actually helps us to assist them in coming out of homelessness. And maybe fewer people, or maybe differently, maybe not in ways that we're doing now. So kind of coming to your
Yeah.
point about, we, for people who are, without any place to stay and without any shelter over their heads, and
That should be the
That
priority
should,
group rather than any characteristic. The priority group should be unsheltered. Not to say, I agree with you, for other folks, we need to have that kind of services to help them have stable,
Mhm.
permanent housing, not couch surfing or whatever they're doing to get by. But in terms of emergency shelter itself, priority should be, what are your current situations, not, or do you have appropriate, the broad definition.
Yeah.
Anyway,
And that may require us to shift resources,
Mhm.
from where they're being utilized now to other places. Yeah. Other folks.
Well, yesterday I might have not used the right word, enabling, so I wrote it down better to say, I worked at school for 10 years and I was on the school board 9 years, and foster kids, there's some pretty good, smart, wonderful foster kids. I brought them home. I took in a college student that was a foster child. My son brought him home. He stayed with us for the summer, very intelligent. I find this insulting and I'm going to advocate for the foster kids. If I were a foster child and I'm being told, oh, you're a foster child, you're 19 to 24, we're going to give you free housing. How degrading and insulting to that child. So I have to advocate for the foster kids because I've had so many come in and out of, I wasn't ever a foster parent, but any kid was always welcome at my house. Whether they were a foster child, I took in a boy that had aged out of the system. He was going to St. Mike's, very smart boy. It's concerning to me and I feel bad for the child that they're being put in this category. So I just want to advocate for the child.
I think, I'm just, what I'm wondering is whether, whether you might be reading too much into that. I think it's about, for folks who don't have access to shelter. So, you know, we all want to support, you know, people to be independent or interdependent with their lives and, you know, developing their own communities and things like that. I think it was just trying to be explicit that even though they are, they could fall into one of the current categories on their own. So I think it was just trying to address that we've seen some folks aging out of DCF that really aged out to homelessness. Not all, but we have seen some. And it was just trying to, I think, be explicit about that. We need to make sure that we're not just kind of like spreading them out to the wind and with no support, I think.
But the way it's written,
I understand.
It's not, yeah, it's
they
not.
can apply as an adult.
I'm just saying.
When I did it in 2014, of course, a 19-year-old could apply. You aren't going to say you're 19, you can't apply, you're an adult. I housed 19-year-olds in their own hotel back then.
Yeah.
So
It's not
it just
just a
makes me
reminder.
feel bad that they're being put in a category. I hurt for the child.
Yeah,
Just a reminder, that's not in the bill.
that's not.
No, I know.
That's a recommendation from the group. Yeah,
Yeah.
just to clarify
I
that.
have to stick up for him because that's the way I am.
And it wasn't all foster kids. There was the other qualifying that they had to be homeless. It's not.
Mhm.
And I do just want to push back around lumping them in with those other people. That is incredibly stigmatizing. Those are Vermonters. Just to say that's insulting is really disappointing to hear.
I didn't even realize I did that. But anyways, recipients, is that better?
Yeah, well, I mean, I
Recipients.
think.
I'll use recipients. I gotta work on my
It's just
grammar,
we're all-
my way of communicating.
We're all Vermonters. I think that's the
I
point.
should say Vermont, other Vermont.
Other
That
Vermonters.
sounds good, better.
That's just,
I'll work on that. That's my fault. I don't mean it that way.
okay, thank you for taking that
I'm
feedback.
taking in a lot of people in my house. If you knew me in my hometown.
Dan.
Yeah, just thinking about the relationship between the state and the agencies that are providing the case management and how do we strengthen that and have the accountability to also make sure that they have these agencies have the support they need and possibly incentives to help people transition to a more permanent housing
Mhm.
and how can we build those supports into this legislation
Yeah.
is important.
Yeah, and I think one of the things that was brought out yesterday, and actually that I've experienced in going through this with different people who contact me about specific cases is it's a little bit hit or miss whether the other sister departments in AHS really get involved. Do you know what I mean?
Yes.
I had a person I was helping who was eligible for Choices for Care.
Mhm.
They received care, they were in a hotel. They were trying to figure things out and they really didn't have the active case management assistance that they needed to do that. And I'm a little concerned, honestly, that even in this conflict-free case management system that's playing out, that the people who are being chosen to provide that really understand what providing case management to somebody who is homeless means, or somebody who is trying to leave a hospital and doesn't really have someplace to go. you know, that means you have to really take the person by the hand and show them options for their housing, if there are some. And, I just, you know, I'm not really sure that people who are being selected for that process by Dale, but Department of Disabilities, Aging and Independent Living, understand that this has to be done from outside of your office. You know, you have to go with people. You have to, yeah.
Highlighted in the report.
I saw that, yeah. You have to, you know, when you just say to somebody, you know, well, there's this residential care opening, you know, address someplace, people they don't know, if you take them by the hand and show them the place and see the people who are living there and, you know, see the relationships you can develop, they have a different impression of it, you know, instead of just saying no, you know, it's not, yeah.
Yeah, the other thing is we have some bigger policies that, you know, are sort of not in the emergency aspect of that, but actually that are not being looked at all. And I hate to say another work group, but I think they do need to. And that's, again, going back to personal experience, those who are been here longer know, but I took in a homeless mom and her 8 and 9 year old child for 3 or 4 months. And one of the things we discovered is, and she was receiving Social Security and Reach Up, which is not a lot of money, but, and food stamps. I took her in from a hotel. And what we discovered is I would have lost my income sensitivity for property tax because she became part of my household income and would have put me over that threshold. And she lost her food stamps because it's based on household income. Now, we ended up getting around that. Okay, I'm on record. You know what? I don't care. Okay, we filed the affidavit saying that we were keeping our food completely separate, you know, with an 8 and a 9 year old, you know, like, you know, drew a magic marker down in the fridge and the pantry, you know, which didn't do. But, you know, outside of actually doing that, you know, she temporarily at least lost her food stamps. And those are the kind of, when you have a housing shortage and you have a potential for a stable piece, but people can't offer that housing because it's going to hurt them so much financially. Well, that's really bad policy in the midst of a housing crisis and people being homeless.
Mm-hmm. Yeah. Good point. Yeah, go ahead.
Thank you. So some of the thoughts from yesterday's meeting, one, I have to say, I was really disappointed in the department's responses. And given that they had every opportunity to participate in the work group and, you know, acknowledging the other members of the work group and their own lack of resources, right? So like we all are stretched thin, and there was several other members that made time to do the work and show up. So just putting that on record. And then number two, really kind of acknowledging back to our guiding principles, the last one is support the human services workforce. And, you know, some of the things we heard from the department was that some of the recommendations would require them to do duplicative work or require a lot of resources on the department's side, but acknowledging that a lot of the community organizations that support the Vermonters that are vulnerable have very, very limited resources. And some of the things that are set up now require a lot of duplicative work and additional resources for them. And just acknowledging that the state government has a lot more infrastructure and resources than a very small community organization that is supporting Vermonters that are unhoused. So really keeping that perspective that whatever goes in here acknowledges that, you know, the behemoth of state government, DCF, has a lot more resources at their disposal and should be looking at innovative ways to streamline services so there isn't duplicative services to, you know, achieve efficiencies versus kind of putting it back on the community organizations where they're going to they may go away because the pressure will become so heavy.
Were you going to say something, Esme?
Yeah, I was thinking about the program implementation and thinking about the future of how it would look like to have a case manager for these folks, really guiding them through the process and how important that is. And one of the things I experienced just like showing up to the motels and saying, what's going on? How can I help? And then I filled in that case manager position for folks one-on-one, spending hours and hours and hours of unpaid labor, just being on the phone with people, trying to help them get SSDI. Totally like why, like, I don't know, it just felt strange for me to be in that role, having no training and obviously unpaid and like, I don't know, just felt like a weird vacancy I was filling. Anyway, in terms of getting folks transitioned out of the program, there was obviously no way to do that because people were stuck in these situations that they had been in for years prior to this. In some cases, not every case. But, with SSDI, for example, that is a real tricky one with some of the differing needs that people have to get that in the first place, like the transport, like I was taking people to doctor's appointments and scheduling them and being on the phone for hours and then getting these appeals that made no sense because this, person had a disability since 1996, but for some reason that disability ended, which it really didn't. And just all these, that is a way to get at least some sorts of, at least a teeny bit of income that could help them transition away from the program. And I just see so many cost efficiency, cost savings elements of having that one-on-one support, which I noticed just from being there, even, in a small capacity that it could be. And I also think it could help us with tracking. What are the biggest drivers of folks being in this program? If we had a professional case manager in these positions, we would have an ability to track, like, what are the biggest holdups for you right now? And we know that the housing crisis is one of them that is blatantly in our face, the price of housing for a normal person with normal needs. But also, I think the medical interwoven nature of it all, I think is really important, and just a more professional way to monitor these things and make sure that people are getting access to the resources that in statute they deserve from state and federal.
I would just add on to that. I would also say here, we want to maximize what people can get out of the services. So back to my earlier point of trying to ensure the services are available to move people out of homelessness. I don't know the answer to this question, but I wonder about the balance or best way to deliver that. It seems like there's some opportunity in a shelter setting to have in place services, one location able to advance those needs, yet it may not provide the dignity for a household that you get out of the use of a hotel motel. So balancing that. And also, while not being an expert on this by any stretch, but initial conversations, I have great concerns about the ability to deliver the services that may be necessary in that hotel motel setting.
Right.
It sounds like, and there are some reports of caseworkers who do not feel safe in going to a location where the program is being run. And that to me seems unacceptable, and that we have to be able to provide basic safety. So I don't know where we'll get with this in this conversation or what we think we can accomplish in this bill, but that tension between how to best deliver the services in a way that provides the most dignity seems to me be a challenge, but one I think we need to take head on.
And just to piggyback off that, basic safety, absolutely number one. Although I would argue that it is absolutely a step up from having to hunt people down in the streets and having no idea where they are because they're completely unsheltered, knowing that they are in a motel that is sponsored by state funds. Like, at least that's slightly better tracking and a slightly better way to facilitate the exchange of information and resources, although absolutely not perfect whatsoever, but it's slightly better than having no idea where folks are in the community.
Right.
Yeah.
The thing that'll be important too is we move through with testimony to get testimony from agencies that did have the responsibility of disseminating case management to individuals within the hotel to hear from that at the ground level. And I think it would also be vitally important that we hear from like field directors within the Agency of Human Services, like the local field directors, to get some of their insight. We hear from the upper management and administration. And of course, we all know that lines of communication are easily can be skewed as they work their way up. And I believe if we could get some of that information from our field directors as well as the agencies providing those, I think that will help us shape things and really acquire that more enhanced
Mhm.
information.
I think,
I was just gonna say, one of the things that I struggle with, and I've struggled with this for all my years in state government as well, is the multiplicity of people who have the title of case manager or service coordinator. And it is, so it's not like there are not resources going into quote unquote case management right now. I mean, on the coordinated entry side of things in the single state, or I'm gonna use the wrong terms, but the money coming in from HUD, which again, who knows what's gonna happen with that, frankly. But there is a lot of money coming into the state through those entities. You know, we have two in the state, even though in the report they consider themselves one. I'm not convinced. In the report, you reported it as one.
It is not, the kind of separating,
Come together.
the merging, I mean, they're two COCs.
Yeah,
We do collaborative applications now to HUD, and we've fixed the issues so that all of our data can be
together. Yeah.
combined as a state. There was one thing that they were kind of documenting that we weren't, and so it,
So it's come together. Okay, good. So, but there are case management resources in that, in the budget funds that come from there. There's, you know, the state spent, you know, several $1 million during the transition out of the, you know, COVID relief funds for, you know, contracting with people doing assessments and case management. And it was, you know, frankly, I think a big waste of money because it didn't really result in any continuity of support. So, you know, trying to figure out how those pieces fit together, because we can't just like add on to it. You know what I mean?
right,
Because we don't have sufficient resources to do
make it
that.
work better.
Yeah, it has to work better than what it's working now. People have to feel like they can, that they have a trusted individual who is going to help them navigate through that. And I like the concept in the report of peer support. I mean, we do peer support in health, we do peer support in disability services. We do peer support in lots of different things. And you know, we actually in recovery, we do peer support. So,
there will be a bell.
so it just seems like, you know, every piece of testimony that I've ever heard in this committee about people who have gone through the situations themselves and come out on the other side, they want to help other people. And they should be recognized as a valued part of the system. And paid for their work, I think, you know, right now that's pretty haphazard, in whether they are or they aren't.
So I think one of the things that's been very helpful in the past with this committee in really understanding, obviously direct testimony from people involved, but also field trips. I mean, I think it'd be very useful to do maybe a sample of visiting a hotel
Yeah,
program, visiting a community-based kind of old traditional congregate shelter. And I mean, you've got one of the new family shelters. in
slated to
Waterbury.
close in April 1st.
Yeah, well, then we better get there fast. But,
Yeah. Yeah, I think that's a good
that sort
idea.
of a selection like that would be really helpful for people to get a sense of, you know,
Mhm.
what are those differences like and what are we doing currently?
All right.
Yeah, that's a great idea to go to actually communities,
Yeah.
that's up, whether it's in a state building for the day to allow the agencies to be able to circulate around and see it for ourselves at the
Yeah.
ground level.
Yeah, and ideally, I can't do that really with hotels, but ideally, if it's daytime, which is what we'd be
Yeah.
limited to, when people aren't there, so there's not a group of people coming around and looking at you, but, you know, but at least seeing the.
Sometimes,
stuff.
lots of times people love an opportunity to have influence and have their voice heard with other
Yeah,
people too. So,
Yeah, that's true.
we'll see what we can do about that. Okay, folks, thank you for this discussion. Helps us kind of frame out and think about, how we organize testimony. And as I say continually, if you have people that you specifically want us to hear from about this topic, please let me know so that we can, work them into the schedule, okay?
You want to hear from some hotel owners?
And like I said,
Talk to-
yeah, just talk to me offline. That would be great.